Hi, my name is Kristy Engel, and I am your Regional Healthcare Missionary for American Baptist International Ministries. It's hard to put into a few sentences what it is that I do because it changes all of the time. So I'll try to tell you a few of the things that my role with International Ministries encompasses. First of all, I do emergency medical relief. So for example, after the Haiti earthquake relief in 2010, I was able to bring medical teams over from the Dominican Republic to Haiti to work in mobile medical clinics in some of the most damaged areas, oftentimes in places where other teams were not going. We've specifically looked for those places where nobody else was reaching. And so for 4 months after the earthquake, we were bringing teams across the border every Monday night and returning back to the Dominican Republic every Friday night. We crossed the border on Friday night and actually got back to La Romana on Saturday morning. We did this for 4 months, and I think we had a total of over 400 or 500 volunteers during that time, and well over 50 individual volunteers that came and stayed in La Romana for more than a week's time as they worked with us. And so that's just one aspect of my role. Another aspect of my role with International Ministries is health education. Sometimes the places that I visit tell me that the thing that they need most is to get their leaders and their healthcare leaders trained in health education. One of the examples of this was when I was visiting Nepal. They told me that the pastors are oftentimes the most educated people in these remote villages. And so when somebody is sick in the village, they will go to the pastor and ask the pastor to help them. Well, the pastor isn't trained in basic medical care to even know if the situation is serious enough to take the patient to the hospital. And so one of the programs that I'm beginning to develop is a training program for non-medical people like pastors or maybe teachers, people who have an education in the village that would be sought out when somebody is sick, and to be giving them a basic healthcare training that then they would be able to recognize when problems are serious enough to be able to know if to take those patients to the hospital or not. Another part of my role is to bring education to our own missionaries, find out what it is that they need to understand or learn or grow in their knowledge about, and find opportunities for them to be trained or learn more. This may be all of us joining together to go to a conference. It may be just getting the information about various conferences to the missionaries so they have that information. Sometimes it may be just posting information, new studies that have come out, new articles that have come out. So I'm continually reading things and making those available to the missionaries that we already have on staff. Sometimes it may be that I have a connection with a specialist in a certain area, and if missionaries are dealing with a specific problem, I can bring that information to them because I have that contact with a professor or a research person who has the most current information, and they would be willing to come to a site where we have missionaries working. It may be that I get specific training myself and then take that to our missionaries and be able to train them as well. So that's just another aspect. One is to link people, resources that we have as volunteers to the sites that need those volunteers. So I will go make visits to the different sites where we have missionaries and find out what it is that they need, what are their healthcare needs, to have those conversations with members of their community as well as the missionaries, and find out how it is that I can partner with them, what those needs are, and even if I personally can't meet those healthcare needs, that I will be able to find the people that can do that. That may be bringing a team, a medical team, and working as a medical team with their ministry. It may be finding an educator who can come in and do training with me. So it's always varied, and one of the greatest joys of my work is to always have it ever changing. And each time that I go out, never quite knowing exactly what's going to happen, but knowing I'm going to be blessed in each moment. Finally, if you'd like to know how you can support this ministry, if you're interested in learning how you can have an impact around the world, in healthcare especially, please contact International Ministries or go onto their website at www.immi.org. www.internationalministries.org and look up Kristy Engel, and you will find ways that you can contribute to this ministry. It may be financial, it may be becoming a prayer partner, it may be learning more about this ministry through reading the journals. But I would ask that you would support this ministry, at least through your prayers. And thank you so much for all that you do and all that you have done for many years to support me. Blessings.